This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com.
Alpha Natural Resources. Consistent with its Running Right process, Alpha is an energy company committed to being a leader in mine safety and an environmental steward. We fuel progress around the world. More information at alphanr.com.
The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Information at vachamber.com.
It's amazing what my students with special needs can accomplish. Their pride is priceless. That's why I teach.
Brought to you by the Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and welcome two guests, one of whom people know, either whether it's from Prince William County as supervisor here in the capital city as a member of the governor's cabinet. They maybe didn't know that you also work for the federal government. You work for state, local, and federal at some time, but in a new capacity here of recent head of the Virginia Hospital and Healthcare Association. Appreciate Sean Connaughton being back with us again, and Dr. Michael McDermott, who's the president and CEO of Mary Washington Hospital and a part of the Hospital Association leadership. And the obvious issue to talk about is what's happening in healthcare in Virginia. There's been a discussion now for, 2 years or more about what would be happening as a result of the Affordable Care Act. So help bring our viewers up to date as far as your perspectives on how things are going in Virginia as we individually and collectively and as a Commonwealth wrestle with what we're going to do regarding the Affordable Care Act.
Well, one of the things that Virginia is very blessed to have is a great hospital and healthcare network. We actually have around 107 hospitals in Virginia. And if you look at the fact that pretty much every Virginian has a great hospital in their community and great systems that support those hospitals, not only do you get great care, but actually the hospitals, like in Michael's case, some of the largest employers in all these communities. In fact, you look at the fact that hospitals have about 115,000 jobs in the hospitals themselves, and then healthcare generally, another 300 and something thousand. I mean, all told, 1 out of every 9 jobs in the Commonwealth is actually tied to hospitals and healthcare. So this is
one
out of every 9 jobs.
Oh,
in fact, this is one of the things we're trying to get people
to
understand is that your hospitals, your healthcare system are actually some of the largest employers. They're there 24/7. But they're great economic drivers, and really when you look at the jobs that are there, some of the highest paying jobs actually in most of these communities, as Michael can attest.
So how are things going in your hospital and up in the Fredericksburg area, in that part of the Commonwealth?
Well, I think healthcare in our country is in a period of major transformation. Some of the things that have brought that about is the rising healthcare costs in our country, yes. But then you combine that with a lot of the regulatory and legislative issues that have come down upon us. And healthcare, I think it's safe to say that healthcare providers and hospitals and health systems in the Commonwealth have faced some difficult times recently. In 2013, I believe about 1/3 of the health systems in the Commonwealth had negative operating margins, and that creates pressures on us.
And I guess there was one hospital out in the far western part of the state that actually ended up closing in
Yes.
Lee County.
And actually, that's sort of one of the challenges in trying to explain to people what's happening, at least on the financial side of hospitals, is they need to see the hospital, quote unquote, close for them to understand that there's a challenge. But in reality, I mean, many hospitals, because of these financial issues, the hospital doors, the building is still there, and people are working in there, but what you're seeing is actually practices actually closing down where the hospitals can't provide different types of services because of the issues on compensation. In fact, it's very difficult when you look out in Southwest Virginia. There are very few OB delivery services being offered to any of the hospitals that are left out there. So the doors are still open. It looks like the hospital is still there and serving the community, but what you're seeing is before they actually close the doors, step by step, services are going away.
Those rural hospitals are really feeling the pressure point, and I think it's the canary in the coal mine to underline some of the issues that we are facing. You know, the Affordable Care Act and some of the structural changes that have been put on the healthcare system as part of that act. And I know it's a political act, but it is the law of the land. And we have to, you know, survive 2 Supreme Court challenges, and we have to face it as it is. And there's a gap that's created there where, as part of that act, hospitals and healthcare systems are being reimbursed at a lower rate. And that was supposed to be compensated for by greater coverage of the underinsured in our Commonwealth. And our state needs to opt into that to bring down some of those taxpayer funds that Virginians are already paying to the federal government, bring them back into our state to keep our hospitals and our health systems competitive, similar to what other states have done. The hospitals and health systems in our state are at a competitive disadvantage to hospitals in other states because those funds aren't coming back into the Commonwealth.
If you step back and you know, just move away from the politics and move away from some of the policies. I mean, the Affordable Care Act is the law, and it's been in effect now for over 5 years. And it's survived, as Michael said, all these challenges. The challenges is everyone's focused on what's happening in the insurance markets, what's happening on the political side. They don't recognize what's happening to the actual providers. And the providers have essentially been told that they have to change their entire business model and how they serve their patients and how they serve their communities. And so they're doing more population health, they're doing more managed care. They're trying to horizontally integrate so that you can provide complete services to people 24/7. The challenge is that comes with an enormous cost. And at the same time, the hospitals and health systems are attempting to meet those new requirements. They're seeing dramatic cuts in the amount of reimbursements that they're getting from the federal and state government. You think about the fact that for Medicaid patients, because of the way the state has dealt with Medicaid previously, the providers are only getting 66 cents on the dollar for the costs of services provided. Medicare is down to 85, 90 cents on the dollar. You add into this where you have a federal law called EMTALA, which essentially requires all hospitals to provide care to people regardless of whether they have insurance or not. And this is a moral obligation as well as a statutory one. Providers are going to serve people whether they're able to pay or not. But you're talking about 5 or 6% of the population is not paying anything at all when they show up. Think about this just from a model of any business where 60% of your average hospital patient mix is Medicaid, Medicare, add another 5 or 6% don't pay anything. And you think about the fact what repercussions that has to systems like Michael's, where they're seeing, you know, dramatic decline in their operating margins because these cuts are real. They're happening and they're accelerating. In fact, we're looking at this year well over $500 million in reimbursement cuts to the hospitals, going up to just a few years from now over $1 billion, up to $1 billion and $1.5 billion. And Michael can actually tell you what's happening to him and his hospital.
And those cuts or the lack of reimbursement that we're pulling back into our Commonwealth from the federal government, it's shared amongst all members of the Commonwealth. Every employer's insurance premiums are reflected in passing those costs along that need to be met. There could be relief for some of that if we were able to draw down these federal dollars into the Commonwealth. and get some of our taxes that we're paying to Washington back into our state.
So on the policy side, as you wrestle with it, dealing perhaps at times because it's Medicaid expansion and some people that has a negative for some policymakers. If you don't call it the Affordable Care Act and you call it by the name of the president, that picks up, it appears, some other opposition. Sean, I'll get you to start because you've been in local government with the second largest county in the Commonwealth. You've been in the executive branch. How do you see it getting to a road to some kind of a compromise that would, I'm sure from your perspectives, that would provide the funding that's needed, but a compromise that would overcome the challenges that have really kept this tied up and nothing really significant happening for the last 2 years here in Virginia?
Listen, what we need to do is try to get people in the public sector and the private sector to understand that all this political posturing is having a dramatic impact on one of the largest employment sectors in the Commonwealth. That not only are we a large economic, essentially a machine, we employ hundreds of thousands of people and they're well-paying jobs. They are, for many of the communities, particularly the rural communities, where right now 50% of the hospitals in the rural area are actually operating in the red, that we've got to deal with this. I mean, put the politics aside, focus on what is happening to our hospitals and try to work together to a solution. Because the thing is as people posture and they do the politics, day in, day out, the financial position of so many hospitals is actually getting worse. And we have all types of studies that show that with all the federal cuts coming, with the fact that we're not getting additional revenues coming in and people are still showing up, whether they're able to pay or not, somebody's paying for those. And right now, a lot of it's being absorbed by the hospitals. A lot of it's being absorbed by all of us with commercial insurance policies, but somebody's paying for that. Eventually, particularly from the hospitals and the provider sector, they're not going to be able to pay for this anymore. It's going to lead to layoffs. It's going to lead to the inability to reinvest into their capital and new technologies and new procedures that can actually help their communities. And it's going to mean less people being able to be employed and served by those hospitals.
It's also an opportunity. I know you mentioned for some Medicaid has a negative connotation, but many states, I think at least 10 states, even with Republican leadership, have found creative ways to restructure Medicaid as a part of pulling those federal dollars back into their states. And so I think there is an opportunity to relook at the Medicaid program and its structure and framework, and to be able to pull those federal dollars back into the Commonwealth of Virginia and fundamentally reform the program.
You know, there's been efforts to studies, whether it's from, I think from JLARC or others, looking at reforming Medicaid. I'm not sure what the timetable here in the Commonwealth in which that would occur, but there's been efforts, as you all well know, the senator who's chosen not to run again, John Watkins here from Central Virginia, Marketplace, Virginia, that was, from my understanding of it, was attempting to draw down some federal money to buy insurance for those that are not insured, a certain large population of those who are not insured. And still it comes back to the challenge of finding a compromise. If I was hearing you correctly, it seems like some of the road to compromise you're suggesting is that people who are affected need to let the policymakers know. Is that what you were saying?
Well, we're all affected.
Yeah.
I mean, that's the thing. I mean, this is an issue that's bigger than just looking at, we're going to see additional people being covered with health insurance. I mean, right now, we're all paying for it. We're paying higher taxes due to the Affordable Care Act. We are seeing cuts to the providers due to cuts in Medicare that essentially we're supposed to be compensated for with the additional amount of covered people out there. And those with commercial policies, like those of us probably sitting around here, we're seeing higher premiums because the hospitals have to charge higher because there is a cost shift in all this. And what we're saying is we just need first people recognize and appreciate what the hospitals and health systems are to their communities. Secondly, recognize that there's a challenge, there's a problem that's getting worse. And if we can at least get people to get to that point, then we can maybe work on a solution, because the whole focus has been on the coverage and not what the direct impacts are to the providers. And so, I mean, and another thing I just going to throw in here, and again, Michael can talk more in detail about this, but people have to understand that the current Medicaid program is there to serve children, the disabled, and the elderly. Okay. And so when people keep on talking about reforming the current system, what we're talking about is a whole new program that is going to be for those who are essentially those with very, very low incomes who are working, who are not making enough to actually get the subsidies to get insurance through the exchanges. So this is to help those people. We want to help move from hourly wages into salaries and who can make more money. And this is a new program, and we have a real opportunity when it comes to this Medicaid expansion, a real opportunity to come up with a program that serves the policy needs of those who are concerned about some of the financial and fiscal impacts of Medicaid expansion, but also can get some real positive public policy points in there that can help us and help those people get to the next step.
Is that what you're seeing too, the need? We tell our viewers that you are a physician, probably one of the few physicians who really are ahead of a healthcare system, as you are. And are you echoing, and from your perspective?
Yeah, I see it as a real opportunity. That what we're talking about is having those federal dollars available to make sure that our fellow neighbors in our communities who do not have the opportunity to have insurance currently are able to have some program available for them to have some coverage. I think that's kind of an underlying mission all of us can get our hands around. These are people that we know, they're our neighbors, they're people that we see every single day. And right now they're in a situation where they're falling through the cracks. They don't have access to catastrophic coverage. They don't have access to the health care coverage that they deserve. And I think we should be able, as a Commonwealth, to come together and structure a program where we can do better.
And you think about one of the big goals of the Affordable Care Act, it's a real laudable goal, is one way to reduce the costs is to get to people before they're chronically or really have major health issues. And so a major focus on population health, on preventative care, on looking on ways to get people to live healthier lifestyles and to monitor that. And the thing is that you do that through insurance and through some of these programs. If they don't have any coverage, they're only going to see them, Michael's only going to see them when they show up in his emergency room with what could have been a minor medical treatment becomes a major cost item for all of us.
Our community is making significant investments in that move to population-based health. We have a Mary Washington Health Alliance, which is a consortium of our health system and the independent physicians in our community that are fundamentally changing the ways we approach healthcare. And the whole end game of that is to keep people healthier in their homes and prevent them from becoming sicker. Now, to do that, it's a significant investment that we need to make to fundamentally change our system. And along with that comes significant investments in information technology and information sharing so that we can share information about the patients in our community with one another in ways that we haven't been able to do before. And to do that, we need to be able to make that investment into those fundamental changes to population health. And I think by pulling those federal dollars back into our Commonwealth, it will allow the health systems in Virginia to help face those demands upon us like other states have done. Not having those dollars available in our Commonwealth puts the hospitals and health systems in Virginia at a competitive disadvantage to the hospitals and health systems in other states.
Instead of expanding Medicaid, let me try something out on you. And it's coming from the conversation we're having together. Could you envision some way, and I don't know if this is happening in some of the other states or not, in which the money really is drawn down from the federal government with their, obviously with their approval, for the healthcare systems. And so instead of Medicaid, in a sense, being expanded, there's some creative way that's worked out that meets state policymakers' approval and meets the federal approval that gets those dollars where you all can be providing, whether that community-based health or the hospitals, and it gets it out of the issue that is an issue for some, right, that says Medicaid expansion. Any
Well, I think the Virginia hospitals are all for creativity. Whatever mechanism we can come up with to be able to do that, we're all for being creative. We've always been there at the table, willing to talk about any options. But we think it is an important issue, and we need to raise the awareness of all members of the Commonwealth about how it impacts them, because it impacts every single member, every single citizen of our Commonwealth.
And you know, it's one of these things where, again, coming back to first recognizing how important we are, secondly, recognizing we have a challenge. And if we can get people to then focus on these things, then we'll work with folks on any of these opportunities to address these problems, because we're trying to make the public policymakers as well as the public understand that as with the trends where they are, and given the cuts that are already occurred and actually starting to accelerate, that it is first you're going to start to see services in various hospitals start to decline. You're going to see people laid off, and then eventually you'll end up seeing potentially hospitals even close. But the thing is that, you know, people are going to see those buildings there, but it's going to be a shell of a building, and for services are being provided. The issue is that, you know, when you have we have everyone running around talking about jobs in Virginia. In fact, last year, Virginia would have had zero job growth if it wasn't for the healthcare sector. These are jobs that the hospitals and healthcare systems added.
I hadn't heard that before.
Yeah, and so here we are. We're one of the biggest economic engines. Where we should be focused on is helping it grow and helping it nurture and provide the type of leadership that we need to help our systems, because we cannot continue doing what we're doing today.
We're having a conversation here in August. General Assembly will be convening January 13th. So the time and the opportunity for people of goodwill on both sides of the issue to be working is sufficient, but it's relatively short to be worked out, if something can happen in 2016.
Well, we're hoping that the General Assembly, the governor, as well as the business community and the public generally, starts to you know, come together and work on this issue with us. It's too important for the future of the Commonwealth. We are going to actually start a public affairs campaign that's really just talking about the importance of hospitals like Michael's to their community. Mary Washington is one of the largest employers in the Fredericksburg area, and you can go through every community throughout the Commonwealth, and what happens when they start to lay off people, what happens when they start to not being able to reinvest in buildings, and what impacts that has. But we first got to get people to understand that we're there. I mean, in some ways, I think the hospitals are taken for granted, because whenever there's an emergency, 24/7, somebody can always drive up there. They don't even think about it. Well, they got to start thinking about it.
I think that hospital in Lee County, they're trying to reopen it in some ways, but as you all know, and as people around the Commonwealth know in rural areas, I know of hospitals that are still open and active, but now maybe they have a patient load of 8 or 10 or 12, where they usually have 2 or 3 times that many because the specialists aren't there.
Yes.
And the fact that their doors are open,
right,
it disguises the underlying pressures that they're feeling as a system, because of the competitive disadvantage that they're being placed at. And so, like Sean mentioned, just the fact that the lights might still be on and the doors are open, when you start to peel back the layers and look at their underlying pressures that those health systems are feeling, they're real, and it will eventually lead to a position where There's decreased services for the community. Patients have to travel further, and eventually layoffs and the closing of those hospitals.
Well, let's hope not, and that's a good point to end on. Our time is up, but thank you both for being on This Week in Richmond.
Happy to be here.
Thank you.
For having
Good
us.
seeing you again.
Yeah.
Thank you.
Thank you.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com.
Alpha Natural Resources, a leader in mine safety and an environmental steward.
The Virginia Chamber of Commerce, the voice of the Virginia business community.
The Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.